Bismillah Rahman Rahim. Assalamu alaikum. On 21st December 2024, that is yesterday, one day symposium was held in Serena Hotel, Peshawar. It was symposium arranged by Pakistan GI and Liver Disease Society. And topic given to me was nutritional and dietary interventions in inflammatory bowel disease. I had promised with the participants of the conference that I will share my lecture on my YouTube channel. So I am recording this lecture for my YouTube, and I'll upload it and share with my other colleagues as well. So today the topic of our discussion is nutritional and dietary interventions in inflammatory bowel disease. Bismillah Rahman Rahim. I am thankful to the organizers of symposium by Pakistan GI and Liver Disease Society with the theme of Turning the Tide, Advancements in Inflammatory Bowel Disease and Colorectal Cancer 2024. An excellent program laid down by the scientific committee. And the assignment given to me is nutritional approaches and dietary interventions for inflammatory bowel disease. Focus areas for today's discussion in my lecture will be, we will briefly see the significance of diet in inflammatory bowel disease. Then we'll discuss the nutrients and foods beneficial for inflammatory bowel disease and those nutrients and foods which needs to be avoided or limited in inflammatory bowel disease. Then we will discuss goals of nutritional approaches in inflammatory bowel disease, followed by dietary interventions in inflammatory bowel disease. And then we'll briefly touch upon the dietary strategies during flare and in remission of inflammatory bowel disease. And at the end, we will see the emerging research in future directions. What's the significance of diet in inflammatory bowel disease? We all know that nutritional approaches and dietary interventions play a significant role in managing inflammatory bowel disease, which includes Crohn's disease and ulcerative colitis. While no single diet works universally, tailored nutritional strategies can reduce symptoms, support remission, and improve quality of life. Nutritional supplementation in inflammatory bowel disease. We know that IBD patients often have nutrient deficiencies due to malabsorption or dietary restrictions. They are deficient in the iron, so we need to address anemia caused by chronic blood loss. Vitamin D, we know it's important for bone health and immune modulation, and these patients need vitamin D supplementation. Calcium, especially if the patient is taking corticosteroids and avoiding dairy products. So they do need calcium. Vitamin B12. It's often low in Crohn's patients with ileal involvement, and they need vitamin B12 supplementation. Then zinc. We know it's important for wound healing and immune function. And the folate, especially in patients on sulfasalazine. So these are the nutrients which these patients are deficient, and they need special supplementation of these nutrients: iron, vitamin D, calcium, B12, folate, and zinc. What are the foods to avoid and consume in ulcerative colitis? Foods to avoid inflammatory bowel disease. These are dairy products, gluten-containing foods, high FODMAP foods, processed and high sugar foods. Most of the patients, they are intolerant of dairy products. So they need to limit or avoid dairy products due to lactose intolerance or sensitivity. Foods containing gluten, such as bread, pasta, and baked goods, may exacerbate symptoms in some individuals, so they may need to avoid it. High FODMAP, we know foods high in FODMAP, such as beans, cabbage, and broccoli, may worsen symptoms in some individuals. And then the processed and high sugar foods. Foods high in sugar, salt, and unhealthy fats can exacerbate inflammation and worsen symptoms. So these foods need to be avoided in patients with inflammatory bowel disease and many of the patients. During flares, spicy foods, high fat foods, alcohol, caffeine, raw vegetables, and dairy products, if lactose intolerant, they should be avoided. And in general, the ultra processed foods, artificial sweeteners like sucralose, and high sugar foods, they can disrupt gut health and they should be avoided. What are the foods to consume in inflammatory bowel disease? These are omega-3 fatty acids, fiber, antioxidants, probiotic rich foods. Omega-3 fatty acids is found in fatty fish, flax seeds, chia seeds, and walnuts. Omega-3s can help reduce inflammation and flare frequency. A high fiber diet can help promote a healthy gut microbiome and reduce inflammation. Foods rich in antioxidants, such as fruits, vegetables, and nuts, can help reduce oxidative stress and inflammation. Foods like yogurt, kefir, kimchi, and sauerkraut contain live cultures and can help promote a healthy gut microbiome. So these foods, omega-3 fatty acids, fibers, antioxidants, and probiotic rich foods, they should be consumed in patients by inflammatory bowel disease. Nutritional therapy for inflammatory bowel disease. The goals of nutritional approaches in inflammatory bowel disease patients, it's manifold. Number one, to induce and maintain remission. Nutritional interventions aim to reduce inflammation, promote healing, and maintain remission. So the first goal of nutritional approach is to induce and maintain remission. The second goal is to manage symptoms. Dietary changes can help alleviate symptoms such as diarrhea, abdominal pain, and weight loss. The third goal is to prevent malnutrition. IBD can lead to malabsorption of nutrients, making it essential to ensure adequate nutrition. And the fourth goal is to support gut health. Nutritional approaches can help promote a healthy gut microbiome. The best diet for inflammatory bowel disease. The dietary interventions for inflammatory bowel disease has many types of diets. One is the Mediterranean diet. Second is the low FODMAP diet. Third is the gluten-free diet. Fourth is specific carbohydrate diet. Fifth is exclusive enteral nutrition and probiotics and prebiotics. Let's discuss these in some detail. The Mediterranean diet. This diet emphasizes whole grains, fruits, vegetables, lean proteins like fish, and healthy fats like olive oil. It's anti-inflammatory and it promotes gut microbiome diversity. The low-fat FODMAP diet. FODMAP stands for fermentable, oligo, monosaccharides, and polyols. These carbohydrates can exacerbate IBD symptoms. A low FODMAP diet reduces bloating and diarrhea, and it requires monitoring to avoid nutritional deficiencies. The gluten-free diet. Some people with inflammatory bowel disease may benefit from a gluten-free diet, particularly those with celiac disease or non-celiac gluten sensitivity. Then is the specific carbohydrate diet SCD. The SCD restricts complex carbohydrates, for example, grains, lactose, and starchy vegetables, to reduce bacterial fermentation and thus can help reduce inflammation. It emphasizes homemade whole foods, that is meats, vegetables, and nuts. Exclusive enteral nutrition or EEN. It involves consuming only elemental or polymeric formulas for a period often used to induce remission in Crohn's disease. Nutrients dense, easily digestible formulas, and they are often prescribed for children but effective in adults as well. They can reduce the need for corticosteroids. Then the probiotics and prebiotics. The probiotics and prebiotics can help promote a healthy gut microbiome, reducing inflammation and improving symptoms. The probiotics like Lactobacillus and Bifidobacterium, they are effective in interventions in inflammatory bowel disease. It also includes yogurt, kefir, sauerkraut, or supplements. Diet chart for ulcerative colitis and Crohn's disease. Those who are treating inflammatory bowel disease patients, you must go through this article, The Dietary Strategies in Inflammatory Bowel Disease. This is a recent article published in Gastroenterology 2024. The Clinical Practice Updates, American Gastroenterology Clinical Practice Update on Diet and Nutritional Therapies in Patients with Inflammatory Bowel Disease and Expert Review. It's an excellent article, and it gives you at least 12 different dietary options for these patients. I'll briefly touch upon the salient features of this article, but I'll request that you please Google out this article and go through it. It's an excellent article. but it suggests the state of inflammatory bowel disease and optimal nutritional approach. By and large, the patients with inflammatory bowel disease, especially when they are in remission, the Mediterranean diet is best for them. In ulcerative colitis, the Mediterranean diets means that there should decrease in red and processed meat because it may induce flares. Then those who are having stricture, the Crohn's disease patients, in patients with strictured IBD, soluble fibers, cooked, steamed, peeled fibers, mashed, blended vegetables, and should be used and chewed well. Roughage like indigestible fibers, unpeeled apples, broccoli, lettuce, and corn, they should be avoided. We proceed further. In inflammatory Crohn disease patients, the enteral nutritional, exclusive enteral nutrition via oral or tube feeds or parenteral nutrition with modified oral diet. This should be considered till the clinical remission is achieved and endoscopic remission is achieved. Then in the pre-op and malnourished who are unable to tolerate regular diet, then exclusive enteral nutrition or parenteral nutrition should be given till they undergo surgery if it is required. Then in patients with abscess Crohn's disease, they should be nil per oral and parenteral nutrition should be given till the surgery is done. Similarly, when there is output fistula, increased output fistula, prolonged ileus, short bowel syndrome, severe malnutrition, or inability to tolerate per oral or enteral nutrition, then parenteral nutrition is required. And in patients with short bowel syndrome and inflammatory bowel disease, again the parenteral nutrition, IV fluids, and per oral when possible. The enteral nutrition, it's the term used when describing use of enteral nutrition through enteric access device, that is feeding tube. The common access devices used are nasojejunal or gastrostomy tube or jejunostomy tube, generally used for those where adequate nutrition is not possible by oral means. It can provide any amount of caloric intake depending on the oral intake adequacy. There is no sufficient evidence to support the use of disease-specific formulas for inflammatory bowel disease. Then exclusive enteral nutrition by mouth or feeding tube. It is generally prescribed by oral route but can be offered by feeding tube as well. No other food via oral means is allowed. It's only this is given. 100% caloric intake is consumed via oral supplement and or polymeric enteral support products. Oral nutrition supplementation should be calorically appropriate and meet esteemed needs for protein, and it does not need to be an elemental formula. It's okay to use even intact protein formulas. Then partial enteral nutrition by mouth or feeding tube, generally prescribed by oral route, but can be offered by feeding tube. Total 50% to 80% caloric goal is achieved through this. Products are consumed in combination with food, either additional libitum or modified diet as in CDD. It's given in 3 phases. In the first phase, in the week 1 to 6, 50% calories via oral supplementation. It serves fresh chicken, eggs, potatoes peeled, cooked, bananas, apple. Additional allowed foods are rice and small amounts of low taurine fish. Restricted foods are red meat, high taurine seafood, and alcohol. Then in the phase 2, from week 7 to week 12, 25% caloric via oral supplementation, serving fresh chicken, eggs, potatoes, bananas. Additional allowed foods are rice, small amounts, fish, gradually increased variety of fruits. All these are given in the article. Then in phase 3, week 13 onwards, 25% caloric via oral supplementation, no required foods. Then it's encouraged to follow phase 2 or on weekdays and a liberalized diet on the weekends. It advances to full fat yogurt and permanent restrictions are soft drinks, processed meats, emulsifiers, and gums. So all these are the shots taken from that article. Please go through that article. It's a beautiful one, and it explains each and everything in detail. So during active disease or flare-ups, elemental or exclusive enteral nutrition is required. Small frequent meals, which are easier on the digestive system and reduces discomfort. Hydration is important. Address dehydration, particularly if diarrhea is severe. And low residue diet, which reduces fiber intake to minimize bowel irritation. It includes white rice, bananas, lean protein, and cooked vegetables. Avoids raw fruits, vegetables, nuts, and seeds. In remission, Mediterranean diet is best. Low FODMAP diet is another good option. Specific carbohydrate diet should be tried. High omega-3 fatty foods are important, and probiotics and fermented foods are of use in patients, IBD patients in remission. And plant-based diet, which incorporates cooked, easily digestible plant foods. These are anti-inflammatory benefits they have got, but fiber intake should be adjusted based on the tolerance. What is the emerging and evidence-based diets? For Crohn disease, there's Crohn's disease exclusion diet, CDED, which combines exclusive enteral nutrition with specific food exclusions, showing promise in maintaining remission. And there's another diet, the anti-inflammatory diet for IBD, IBD8. It's a modified specific carbohydrate diet that includes prebiotic and probiotic foods. What's the role of lifestyle and behavioral consideration? We should advocate the mindful eating, which will result in avoiding overeating and consume meals slowly. We should aim for stress reduction. The chronic stress worsens IBD symptoms, so better to consider meditation and yoga exercises. And of course, work with a dietitian is very important. Tailor dietary plans to individual needs and monitor for deficiencies. What are the future directions? Precision nutrition, this is very important. Tailoring diets based on genetic, microbiome, and metabolic profiles. Of course, prebiotics, the fiber-rich compounds that feed beneficial gut bacteria. And postbiotics, beneficial metabolites produced by gut bacteria, that is short-chain fatty acids like butyrate. The key takeaways from my today's discussion is dietary management should be individualized and often involves trial and error. Collaboration between patients, dietitians, and healthcare providers ensures optimal outcome. So thank you very much for watching this vlog on the nutritional approaches and dietary interventions in IBD. You can scan this and log into my channel. You can subscribe my channel and see all my lectures available on the different topics as a CME attempt. So once again, thank you very much, the organizers, for inviting me to the symposium. And I'm sure that the assignment given to me, I have tried to simplify you and clear in simple words that what should be the dietary and nutritional interventions in patients with inflammatory bowel disease. So I end here. If there are any comments, any questions, please ask in the comment section and I will try to answer that. Thank you very much.